Hello, welcome to my YouTube channel. This is part two of the perioperative phases of surgical care. So I made a video about your pre-admission phase, which is the pre-op phase, where you need to have all your lab and um, your lab test and your imaging test done, especially if it's an orthopedic procedure. You need to have x-rays for the doctors to evaluate. And also, most patients with cardiac diseases scheduled for surgery has to have most patients need to have cardiac clearance. And if you have any chronic diseases based on the specialty, your primary doctor following you for that particular procedure has to clear you for that procedure because surgery is a serious matter. A lot of medication is going to be given to you during surgery. The whole body is going to go through a big change. So it's critical that your primary doctor, who knows you well, has to make sure that you are ready for surgery. The nurses usually will call you ahead of time and give you some instructions. Your doctor's office usually also will give you a paper, detailing, kind of giving you the pre-op instructions on what to expect and what to do. Please find time and read it. Don't Google it. Just use whatever your doctor has told you, has given you. Just go through that because sometimes things found online, and I'm not saying um, online information is wrong. No, but your doctor knows you well. He knows what he's going to do. Your nurses, your nurse practitioners, your physician assistants, they know you very well. So based on what they are going to do for you, based on the type of surgery you're going to have done, it's always best to follow their specific instructions and not something on Google. I've had patients show up to have different type of surgery, and they probably prepped themselves wrongly because they found something online. Oh, I went and Google. I'm like, no, that is a generic version of what you need to do. So on the day of surgery, based on what you haven't done, generally the nurses tell you to come in 2 hours before your surgery. It's critical that you show up 2 hours before. And it's not just because we just want you to come in and just sit and wait. There is processes needs to take place. You need to register. Registration takes time. And mind you are not the only person who is having surgery. There are many people. So you might find other people ahead of you. Sometimes there is one or two people at the desk registering patients. So if you come in late, you're already behind, and the registration process takes time, and you're already behind people who are following orders and coming on time. So it's always best if your surgery is scheduled for 7 o'clock and you are asked to come in at 5 o'clock. Please show up at 5 o'clock. Once you register, oh, and please come in with the loved one. Don't come to the hospital to have surgery by yourself. Sometimes I understand circumstances will require you to come in alone and have a loved one pick you up later. But if you can, I always encourage patients to come in with a loved one. It reduces the stress, tension. It's a moral support. You are having surgery, and you might say, oh, it's a minor surgery. Surgery is surgery is surgery. It's nerve-wracking. So it's always best to come in with someone. When you come in after registration, this is how it goes. The nurses will see on the computer that you are registered. We have color coded based on the hospital. Every system is different, but usually it's color coded. So once you show up, the color will change. That once you show up and register, message is sent to the nurse's computer that you are ready to be prepped for the actual surgery. So the nurses will come in and call you. Your family member, if possible, unless the person needs an interpreter, but we have a system that interprets for us. The hospital prefers, if you are foreign, English is your second language, we have a system, a computer system that translates for the patient. Or it's always if the family member feels like the loved one feel like they need to be with you, or they are almost, every time they are almost welcome to come in. But preferably, because the spaces that these nurses work is quite small for the pre-op processes, it's always best to give the nurse about 30 minutes to prep your loved one, and they will bring you in. But what I always advise patients, loved ones to do is to come in before the surgery team shows up, because a lot of stuff is going to be explained to the patient. This is when you have an opportunity to ask your questions. Anesthesia will also come and also explain how they are going to keep you comfortable while you sleep for your surgery. So there's a lot of medication. Some procedures per protocol requires the nurses to give you certain medications. Some antibiotics are usually started on that same process, that same time. Anesthesia will come in, have you sign consent. The doctor will have you sign consent. So I'll follow up with a post-op phase. The intra phase, the intra-op phase, I am not very familiar because I don't work in the OR, but I know the post-op phase quite well. So I will follow up with the post-op phase, what you should expect. So thank you for watching, and watch the next video for the third part. Thank you.